afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're happy you could join us. We're also happy to be joined this afternoon by the Mayor of London, Ed Holder, the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie, and the Medical Director at LHSC, Dr. Adam Ducalo. Thank you to the media who are here today, and just a quick reminder to submit your questions using the question form here on Microsoft Teams. Just please indicate your name as well as your media outlet and who your question is for. And to the viewers who are joining us, a welcome this afternoon. If you're on Rogers Television, the Rogers Facebook page, or the YouTube channel, as well as listeners to Global News Radio, AM 980 CFPL, and those who are watching us on the CTV News London website. Let's begin with our opening remarks, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. Today, my message is a simple one. Nobody in London likes where we are right now. Nobody in London wants our situation to worsen, and everybody in London wants things to improve as fast as possible. As such, we have only three options. First, we can stay where we are in red and under these current restrictions, or the province can decide to place us into full-on lockdown, or we can work like hell to turn this around and get back to orange. So that's my focus, and I hope that's everyone's focus right now. It needs to be. There are too many people depending on us from a health perspective, and there are too many businesses pleading for the same from an economic perspective. Here's the truth. This begins and ends with us. There are many who are understandably excited and encouraged by news of vaccines, which are slowly starting to be administered. And there are others who think the only solution is more restrictions and widespread lockdowns. We've seen in places like Peel and especially Toronto, where they've been in full-on lockdown for weeks, yet cases there continue to shatter daily records. And that's with that lockdown in place. Look, ultimately, if people don't listen, if people don't take precautions or think about the well-being and welfare of others, these measures on their own do not and cannot work. As I said a moment ago, this begins and ends with us. Our biggest risk right now, at least in the short term, are the holiday parties and Christmas gatherings. We simply can't do it this year. It's too risky. It's too dangerous. I said I'd be brief, and I'll stick to that. My message today is simply, be smart, be considerate, be safe, and be vigilant. Over to you, Dr. Mackie.
Thank you very much, Mr. Mayor. As always, your comments are much appreciated and right on point. We can all make a difference, and seeing so much great behavior in the communities right now, and also, new day with a new high of case counts. The 58 cases today are about 5 cases more than we had on Sunday and Monday, which were our previous highs today. Unfortunately, 1 new death as well today. So this second wave continues to batter our community pretty hard. What we're seeing also in GTA is pretty concerning. The pressure on hospitals and intensive care in that area is intense. Pardon the pun, poor choice of words there. But the clinicians are definitely reporting that they're seeing very difficult caseloads in their ICUs, and we're very much hoping that we're able to get a handle on this here before we end up going there. Yes, the vaccine is a great hopeful thing that we're seeing more and more evidence around the effectiveness. Plans are coming together for a rollout, all very exciting, and that will make a difference, and hopefully it will make a difference in the places where we have vulnerable people first, so that we can really start to stem the tide of mortality. So with that, very happy that we have Dr. Adam Ducalo here, and I'll go.
Thank you very much, Dr. Mackie and Mayor Holder. Thank you for having me again today for your press conference. I appreciate the opportunity to join you and provide an update on the outbreak situation, as well as our evolving COVID response at London Health Sciences Centre. Just in summary of the outbreak from University Hospital, currently we have 76 patients that have been affected and 77 staff. And unfortunately, as Dr. Mackie just mentioned, we've added a 17th death today. And I want to again extend the condolences of the entire LHC family to the family of the individuals affected. At Victoria Hospital, you've no doubt heard that we have announced 2 units on outbreak, our C6-400 acute medicine and C5-100 otolaryngology, burns, and plastic. There are less than 5 patients associated with each of these outbreaks, so I can't give you exact numbers. My apologies for that, but that's due to patient privacy. The outbreaks themselves are not related to each other, and neither is linked in any way to the outbreak at University Hospital, other than they share the same virus. I am pleased to report, though, we've resolved 2 outbreaks at University Hospital this week, one on our multi-organ transplant unit and the other on the 8 inpatient general surgery ward. I think it's safe to say that we are turning the corner on the University Hospital outbreaks, and the containment strategies we've been put in place are working. Unfortunately, however, in keeping with Dr. Mackie and Mayor Holder's comments, we are expecting an imminent surge of COVID-19 patients as the cases have risen in our community. The surge will actually have an impact on the services that we normally provide. And as always, we are proactive to try and communicate this with our community. Hence my request to Dr. Mackie and the health unit to join this press conference today. LHC's top priority is always to be able to provide high quality healthcare to our community through a fully functioning hospital working at capacity. Unfortunately, COVID has forced us to make difficult decisions to manage this global pandemic. We are a key organization in stopping the spread and caring for those affected by the virus. Each and every day, our entire team is working on so many different fronts to get us to the long-term goal. But today, that means containing the outbreaks, which we're turning the corner on, stopping further spread, and being ready to respond to the inevitable surge. Unfortunately, this requires a reduction in services I just talked about. We also need to be ready to play a role in the rollout of a vaccine when it comes to our community. As a red zone, based on what has been released by the province, we do anticipate some involvement. Eventually, the most important thing is caring for our community and returning to the services we provide. We remain deeply appreciative of the ongoing efforts of our staff and physicians, as well as our community as a collective as we battle through the COVID pandemic. We are also deeply appreciative of our community health partners who are coming to our community's aid to help spread the capacity concerns that we have. This is just another reminder to follow the instructions or advice given by Mayor Holder and Dr. Mackie to please stay safe over the coming weeks. Thank you, and I'll turn it back to Dan.
Thank you very much, Dr. Ducalo, Dr. Mackie, and Mayor Holder. Well, we do have a lot of questions, gentlemen, so let's get to them right away. Not surprisingly, there are a lot of questions about vaccines. So let's begin with the first, Dr. Mackie. Dr. Ducalo, this is for both of you. So we'll see who'd like to take it first. Here's the question. It's from Jennifer Beeman at the London Free Press. Do we have a tentative arrival date for vaccines? Which LHSC campus will the vaccinations take place? And which local long-term care workers or hospital staff will be prioritized for these initial doses? Dr. Mackie, do you want to start on that one?
Sure. I appreciate the question, and also appreciate, Jennifer. It looks like you logged in almost 20 minutes early to be the first question, so thank you for that. And so first question around, do we have a tentative arrival date? We do. The ministry has asked that all questions around details be referred to them. So unfortunately, we can't speak to those details. Around the vaccination campus that will take place, the answer is the same. Which local long-term care workers or hospital staff will be prioritized for the initial doses. Again, rollout details ideally will be announced very soon, but at this point, only the ministry is authorized to speak to them.
All right, Dr. Ducalo, any follow-up there?
No, I think Dr. Mackie summed it up well, not surprisingly.
All right. Well, let's go to the next question, Dr. Ducalo. This one is for you. And again, it's a follow-up from Jennifer Beeman at the Free Press. Dr. Ducalo, LHSC is on high alert for COVID-19 outbreaks as it works to address the situation at UH. How did the 2 outbreaks at Victoria Hospital begin, and how were they discovered?
So they were discovered after symptomatic testing. it's safe to say they began because of the rise of COVID all around our hospitals and in our community. Unfortunately, all hospitals and other facilities across the province are doing everything we can to prevent outbreaks. But it's, my understanding through experts that we will continue to see, despite our best efforts, small outbreaks. And then we have to do everything to contain the outbreaks once they've started. So I hope that's answered your question, Jen. But we do anticipate that we will continue to see small outbreaks despite our best efforts and doing everything to prevent them.
Thank you, Dr. Ducalo. And Jennifer did have a follow-up question. How is hospital capacity holding up at LHSC? Are the COVID-19 outbreaks at Victoria Hospital and UH having a negative impact on capacity?
It's a great question, Jen. And unfortunately, hospital capacity is a bit of a complicated scenario, but I'll do my best to respond. So whenever we have a unit on outbreak, it does limit the number of beds we can admit to in the hospital. So that does decrease the denominator, so to speak, on the capacity equation. It also limits our ability to move health human resources as we normally would and move patients. So there is definitely an impact on capacity. However, as I mentioned earlier in the conference, we have been able to take a couple units off outbreak. So we have had some improvement to the denominator at UH given that. Needless to say, our capacity at Victoria Hospital is currently very constrained because we've had to move many patients that would have normally been admitted to University Hospital to Vic. Hence, what I mentioned in my opening comments, we've reached out to regional partners and do anticipate decanting some acute patients to area hospitals in order to help with the capacity challenges at Victoria Hospital.
Thank you, Dr. Ducalo. All right, Jennifer, we're going to come back to some of your questions, but we're going to move ahead to get some other folks in. Andrew Graham at Global News Radio, AM 980 CFPL. Dr. Mackie has a question for you. Given the current numbers, Dr. Mackie, do you foresee Middlesex-London moving into the gray lockdown tier of Ontario's COVID-19 response framework next week?
Yeah, the gray level is much more complex to try and predict. It doesn't have strict cutoffs around case counts or anything else. It is more of a judgment call, and I think that's appropriate given how different case counts can be impacting different communities so differently, depending on public health capacity, healthcare capacity, etc. So I wouldn't be able to make a prediction right now about what the cabinet will choose to do around this community in the next week.
Thank you, Dr. Mackie. And a follow-up question from Andrew Graham, this one for Dr. Ducalo. Given the ongoing outbreaks, will LHSC be able to meet Ontario Health's request to have hospitals ready to implement surge capacity plans?
We absolutely plan to, and we're working on that as we speak. That is actually relates back to Jen's question around decanting some of our capacity. We've opened 24 additional beds at Victoria Hospital, and we are also working to open up another 26 beds in the month of January. So we are absolutely working towards having 15% of capacity open to deal with incoming COVID patients.
Thank you, Dr. Ducalo. On to our next question. Merrick Sutherland at CTV News is tuning in today. Dr. Mackie, testing at assessment centers is booked as of this morning until Monday afternoon, so 4 days from now. That is a stark increase from just the past couple of weeks. What can be done to lower that time frame, and is this an indicator for the surge that health professionals are warning about?
Yeah, we're definitely experiencing the surge here, and it's a headwind from the perspective of knowing who has COVID being delayed, from the perspective of people, potentially not getting tested because of those waits, and also from the perspective of knowing where we're at in the outbreak. The numbers that we have now, we know, are lower than what's actually happening in the community because of that testing delay. The assessment centers are funded through Ontario Health by the provincial government. They're operated by Thames Valley Family Health Team and Melanated Health Science Center. I know they're all working as hard as they can. Health human resources are a major challenge right now in terms of the number of people that are required for operations across the healthcare system. And so that's why you're seeing that crunch there. And unfortunately, the timing isn't great from the perspective of where we're at in our case counts right now.
Thank you, Dr. Mackie. A follow-up question from Merrick, and this one is for Dr. Mackie and for Mayor Holder. Are there any ongoing discussions about a circuit breaker lockdown being put into effect either during the holidays or after?
So I'm happy to start. I mean, certainly that has been raised by medical officers of health and others. You can see the case for it, given that we're going into a period when there usually is less travel and economic activity, and that we know that the risks around people gathering indoors are potentially increased during this period. So I think there certainly is a case to be made, but that is obviously a big provincial decision to make.
Mayor Holder?
Thanks very much, and I think Dr. Mackie has articulated that well. Look, the focus on the medical side really does mean that this response more properly comes from MLHU. So I appreciate the question.
Thank you very much. Let's move down to our questions from Sophia Rodriguez at CBC London. Dr. Mackie, this one is for you. And again, this is a question about vaccines. Dr. Mackie, we've seen a memo from the health unit regarding COVID-19 vaccines coming in a matter of days. When exactly will vaccines arrive? How many doses is London expected to get in this first shipment? Is there any further information you can provide on vaccine rollout?
Yeah, I appreciate the question, and also we've been directed not to speak to those details. I'm sure they will be available soon, and we're all hoping that it comes out sooner, so we can really continue with getting everyone on the same page.
All right, thank you, Dr. Mackie. Let's move back to Jennifer Beeman had a question, and Jennifer is asking, this is a question for Dr. Ducalo and Dr. Mackie. The Ontario Hospital Association called on the province to implement a 4-week lockdown in red and gray zones. Do you agree with the OHA's position?
Well, so maybe I'll just comment that I think Dr. Ducalo's comments will be most informative here. I certainly understand why the OHA is asking for this in terms of the pressure on hospitals right now. I would say that they are the experts in terms of what's going to impact the hospital's capacity. So I'm not sure, Dr. Ducalo, if you want to add.
Thanks, Dr. Mackie, and thanks, Dan. And certainly, as I've already said, we're under tremendous pressure without a significant onslaught, or without the onslaught of COVID patients we're anticipating. And so anything that can be done by our community to reduce the number of patients that will end up needing care in the hospital would be appreciated. I would definitely leave it to the experts like Dr. Mackie and his colleagues to determine the best way to do that, and if the lockdown approach is the way to go, that's the way we should go. Recognizing there's lots of impacts of doing that. The other thing that I think is germane to this topic is that the patients that we're seeing today probably caught the virus a week and a half or 2 weeks ago. So even if we went to lockdown on next Monday or the following week, and I have no intelligence that would suggest we were going to do that myself, we would still be seeing cases for weeks. So these are delayed responses to public health measures when we increase the severity of them.
Thank you both for those responses. Let's move on to the next question. This one is another question from Merrick Sutherland at CTV News. Dr. Mackie, you have said at previous briefings an extended school break wasn't being considered and could actually have a counter effect. We have learned students will be taking a letter home today to ensure all materials needed for remote learning are to be brought home tomorrow. With the worsening situation in the province and the city, is it likely students will not be returning to school at the beginning of January?
Well, certainly we hadn't put it on the list locally, but I mean, I understand from the comments of the minister that it has been considered provincially. I think the question, is it likely? We cannot answer right now. I think that all we could say is it is possible. My hope would be that if there is an extended school break, that it is done on a jurisdiction by jurisdiction or board by board basis, so that students in places like Middlesex and London, where there have been very small numbers of cases acquired in school can continue to go to school. There obviously are long-term educational impacts to school closures, even with remote learning, particularly for the youngest students who can't always engage fully that way. So clearly, there are downsides, and we're just not seeing it here in terms of spread within schools.
Thank you, Dr. Mackie. Let's move on to our next question. Our next question comes to us from Denise Paglinawan from Canadian Press. I hope I got that right, Denise. This is for Dr. Ducalo. Dr. Ducalo, are there any staff cases at Victoria Hospital?
There are, but it's less than 5, so I can't give you an exact number. My apologies.
Okay, very good. And a follow-up from Jennifer Beeman. Do we know how many patients you're hoping to decant from Victoria Hospital, Dr. Ducalo? And if so, what kinds of patients are they?
Great question again, Jen. So we don't have an exact number. We actually have a follow-up discussion with our regional hospital partners later today to determine what the art of the possible is. So we're having excellent collaboration from neighboring hospitals like Middlesex Health Alliance and St. Thomas Elgin General and Woodstock and Tillsonburg. And so we have a meeting with many of them and others later today to determine what the best role is for each of us to play in the health system. And in terms of the type of patients, we know that on a regular basis, we often care for patients in London that could be cared equally as well for, or even in a community hospital. So we would call that sort of secondary care, things like a pneumonia that could get admitted in St. Thomas or in London, and doesn't necessarily need some of the tertiary or quaternary services we offer at LHSC. So those are the type of patients that we're identifying and considering for transfer.
Thank you, Dr. Ducalo. And a follow-up, are there any service reductions at LHSC other than the ones triggered by the UH outbreaks?
Thank you very much. So there will likely be service reductions at Victoria Hospital. There will not be further service reductions at University Hospital, as right now it has been limited to urgent and emergent work. Our goal is to, as soon as possible, actually increase the services at University Hospital that are available, but at the same time, there'll likely be some decrease at Victoria Hospital.
Thank you. And Dr. Ducalo, a follow-up question we just got in from Denise from the Canadian Press. Dr. Ducalo, once again, are you still transferring medical patients from University Hospital to Victoria Hospital now that Victoria has an outbreak as well?
Another great question. So we still have outbreaks on the medicine units at University Hospital, so we are not admitting to those units at University Hospital. We do have beds in medical units at Victoria Hospital that are not in outbreak. So we are transferring patients that present to the University Hospital Emergency Department and be admitted to a medical service. We are transferring them to Victoria Hospital.
Thank you very much. We've got a couple of questions from Sophia Rodriguez. The first question, I think the answer is going to seem familiar, but want to get the question in anyway. Dr. Mackie, we've seen part of the plan to vaccinate staff at long-term care and retirement homes is the plan to vaccinate other healthcare workers like those at LHSC when the first shipment arrives. If they won't receive a vaccine from the first shipment, when will they get vaccinated?
Well, what I can say is that healthcare workers will be, offered the vaccine. There absolutely is a plan to vaccinate, all healthcare workers who are open to that. I can tell you we've had, the polling around vaccine hesitancy is looking pretty reasonable. Vast majority of people willing to get the vaccine. That's great. And there is a lot of uncertainty right now in terms, I should say there's a lot of information that we can't speak to right now. Those details will be announced soon. I think it's important to focus on some of the things we do know about the vaccine. It's a very effective vaccine. It will for sure make a difference in this pandemic. It's a very safe vaccine from the point of view of severe side effects. Really not seeing much there. There are some side effects to this vaccine. Things like fever, for example, that, if you vaccinated, for example, a whole population of staff in a home, you might see fever come up in a certain number of those, and that could affect staffing levels. So that's a big consideration. But, it's a very touchy vaccine as well from the perspective of transport. So it won't be easy to move this first vaccine out into all of the places where it is needed. So that limits who can be vaccinated and how. But in terms of exactly who's in line, where, when, those details should be forthcoming very soon. Unfortunately, we can't speak to them right now.
Thank you, Dr. Mackie. And a follow-up from Sophia Rodriguez. Dr. Mackie, can I ask you to look into the crystal ball a little bit here? When is the health unit, what is the health unit expecting when it comes to cases after the holidays?
Well, it's a great question. I would look back to some of the holidays that we've seen that there haven't, Mother's Day was a good example earlier on when we were still in the first wave. Thanksgiving, another example more recently. It certainly, there were disease, spread incidents on those days just like every other day, but we didn't see a significant bump. Christmas is different. It's such an embedded cultural thing for many people to spend time with extended family at Christmas, and I think that'll be a harder thing for people to let go of. Really hoping that people do choose safe ways of doing that, whether it's online or small groups outdoors, physically distanced. But if I had to make a prediction, I would say it's going to be a factor.
Thank you, Dr. Mackie. And we received another question that just came in. Dr. Ducolo, this one is for you. It's from Jennifer Beeman at the Free Press. Dr. Ducolo, you mentioned service disruptions. What kind of service disruptions at Victoria Hospital? She's asking whether that would be surgery cancellations or something else.
Thank you very much, Jen. So I'll start by saying that any patient that is affected by this disruptions will be contacted directly by the provider. So no need to worry that and you haven't heard from your provider, please attend your appointment or procedure. We're in the process, our leadership team, physician and administrative leaders are in the process of determining how we can continue to serve a community, but also create the capacity that we need. So I can't give you specifics on the actual service disruptions, but what I can tell you is the types of services that put pressure on the resources of people, our health human resources providers and beds. So often that is procedures and surgeries, but we're working through the specifics right now.
Great. Thank you very much, Dr. Ducolo. Thank you, Dr. Mackie, and thank you, Mayor Holder, very much for your time this afternoon, for your insights, and for the information you've shared. That brings us to the end of this afternoon's virtual media briefing. Thank you for joining us as well. We'll be back on Monday afternoon at 2 o'clock, and we look forward to seeing you then. Have a great rest of your Thursday.